Vanakkam, good morning. In this video, we are going to discuss about the neuromuscular junction, otherwise called as the myoneural junction. This is the important short notes routinely asked question in the university examination. This diagram depicts the structure of the myoneural junction or neuromuscular junction. This is the axon terminal. So it forms the presynaptic membrane for the neuromuscular junction. So this is the postsynaptic membrane. This is the cell membrane of the muscle sarcolemma. It forms the postsynaptic membrane. The space between the presynaptic membrane and postsynaptic membrane is called as the synaptic cleft. The diameter of the synaptic cleft is the 100 nanometer. The neuromuscular system junction, the presynaptic membrane is more number of the mitochondria. It is metabolically active. So it has the synaptic vesicles. That vesicles contains the acetylcholine. Each vesicles contains 200 to 600 acetylcholine. Acetylcholine is formed by a acetyl-CoA plus choline by acetyltransferase enzyme that is packed in the presynaptic membrane, forms the synaptic vesicles. Presynaptic membrane also having the voltage gated calcium channels. Here it contains voltage gated calcium channels. The acetylcholine receptors are located in the postsynaptic membrane. The per micrometer of the postsynaptic membrane contains the more than 10,000 acetylcholine receptors. Mechanism of transmission of impulse through the neuromuscular junction. When the impulse travels through the axon, it reaches the presynaptic membrane. Axon potential reaches at the level of presynaptic nerve terminal. It produces the depolarization of the presynaptic nerve terminal. It opening the voltage gated calcium channels. So that fusion of the synaptic vesicles with the presynaptic membrane by the proteins synaptoprevin, snare protein and snap protein. So that is the synaptic vesicle is attached with the presynaptic membrane and it produces the exocytosis into the synaptic cleft. Release of acetylcholine into the synaptic cleft. Acetylcholine is bind with the nicotinic acetylcholine receptor located in the postsynaptic membrane. Some of the acetylcholine is destroyed by the acetylcholine esterase located in the synaptic cleft that catalyzes the acetylcholine to the choline and acetate that is used for the resynthesis. When the acetylcholine is bind with the acetylcholine receptor, it opens the sodium cated channels, produces the depolarization of the postsynaptic membrane, it generation of the local potential. So the local potential is not propagated, it produces the end plate potential. The postsynaptic membrane is otherwise called as the end plate area. So it produces the end plate potential. When the end plate potential reaches the threshold level, due to the summation of the end plate potential, it produces the axon potential. So the excess acetylcholine is hydrolyzed by the acetylcholine esterase. Acetylcholine is converted to the acetate and choline. Acetate is entered into the extracellular fluid. Choline is reused for the synthesis of the acetylcholine. Acetylcholine synthesized from the presynaptic membrane from acetyl-CoA plus choline by acetyl-CoA transferase stored in the synaptic vesicle. It is transferred to the synaptic club through exocytosis. In the synaptic club, the acetylcholine bind with the acetylcholine receptor. Some of the acetylcholine is hydrolyzed by the acetylcholine esterase. It produces the choline and acetate. Acetate is entered into the ECF. Choline is used for the resynthesis of the acetylcholine. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.